So this is nothing but sporotrichosis. Now the next question they ask is, what are the diseases that spread in the sporotrichoid fashion or lymphocutaneous fashion? So these are nocardia, Mycobacterium marinum, so an interesting mnemonic, loveful wedding nail. Here you can see V in the head and in the hand and feet. So in head, the विंड and wind blasting causes SIADH, and हाथ और पैर में क्या होता है, peripheral neuritis. C is present in the face, smiling, and in the ear, so it will cause ototoxicity, nausea, vomiting, and here the C is also present in the kidney, so nephrotoxic. In NEET PG 2024, approximately 55 to 60% of the questions were image based. So I thought that let's discuss some of the important images so that you don't get confused in the main exam hall and you know what to look in the image based questions. So I am here with some of the important images of the paraclinical subjects. Let's start with the first one. In case of histopathology, at first try to see the patterns. Here I can see there is an lining epithelium because एक गो साइड तो पूरा सफेद है, so there is a lining epithelium. Let's notice that what is the lining epithelium. So in my right side, that is this side, I can see that there are layers of nucleus. So it is a stratified epithelium. Now what kind of stratified epithelium? In case of stratified squamous epithelium, what I use is that you will see a gradient. Okay, in the base there are more number of nucleus, so more basophilic. Slowly it becomes less basophilic, so there is a gradient. This is stratified squamous epithelium. And on my left side, if I see that there are the nucleus lying in the bottom and the cells are rectangular, so this is a columnar epithelium. Now from squamous epithelium, it is transforming to columnar epithelium. So this is a case of Barrett's esophagus. And the special stain to confirm the diagnosis is to do an Alcian blue or mucicaramine stain to stain the mucus, because in the columnar epithelium there are goblet cells and goblet cells have mucin in them. So this is the special stain we use. Let's move on to the next image. Here we can see a large cell. Within that there are intact small cells. This process of having intact small cells in a large cell is known as emperipolesis, and the main disease it is found in Rosai-Dorfman. It is also seen in hemophagocytosis associated with myelodysplastic syndromes and all the leukemias. But most commonly, the thing they ask in the question is the Rosai-Dorfman. If you are liking this video and you are getting some new knowledge, then do subscribe to my channel. This is an important chart which I have included in my PDF and you don't get it in your notes. So all the types of RBC abnormalities and I have highlighted which all you should study. Now let's focus on this image. As you can see a bit of cytoplasm. So this is probably a myeloblast and you can see some nucleoli also, more than 3 to 5 nuclei. So this is a myeloblast. In the myeloblast you see some rods. These are called OR rods. When there are multiple OR rods, it is called a phagocell and it is seen in APML or AML M3. The translocation most commonly associated is the 1517 and it is called PML RARA translocation. Drug of choice is all trans retinoic acid, which has markedly improved the disease prognosis. And the side effect of ATRA is the differentiation syndrome, where you can see some pulmonary infiltrate. The person will complain of dyspnea, and the drug of choice is, because it is a reaction कि पहले इमेच्योर सेल से मेच्योर हो जा रहा है, उसका रिएक्शन कर रहा है बॉडी. So reaction को counter करने के लिए you give an immunosuppressant, that is the steroids. Like this, from one image you have to correlate all the previous year questions. In this span of 1 minute, I covered approximately 15 previous year questions. Like this, you have to correlate and study. Here are the important files which you see in internship. These all are compiled in a single page, and the PYQs which have been asked, I have marked with PYQ. The link of this notes is given in the description box below. If you want to purchase it, it's up to you. And this is not to create any FOMO, because hardly it is of 60 pages, and to have a look over all the important images, it will take 2 to 3 hours. So it won't take a lot of time also, because saw that there is a lacuna in a digital image bank. No other app is having this kind of digital image bank. So I thought of making one such, and now I have made the paraclinical one. Slowly I will make all subjects one also. So this is an important image where you can see some cocci inside the cell and outside the cell. So intra and extracellular, which are gram negative. So these are gonococci, and you see a frank urethral discharge which is called seeds in the urine. And when it is spreading to whole of the peritoneum, it causes perihepatitis called the Fitzhugh-Curtis syndrome, where you see violin like strings attached to the liver surface. Next images are a hot favorite of mycology. So here you can see brown bodies. These are called copper penny bodies, sclerotic bodies, or medullary bodies. These are a classical finding of the chromoblastomycosis. After that is, you can see along the lymphatic in a linear pattern the disease has spread. This occurs due to thorn prick, and also called the rose gardener disease, found in the sub-Himalayan region. So this is nothing but sporotrichosis. Now the next question they ask is, what are the diseases that spread in the sporotrichoid fashion or lymphocutaneous fashion? So these are nocardia, Mycobacterium marinum, or atypical mycobacteria, cat scratch, and lymphatic variant of lupus vulgaris. In histopathology, what you can see is that a star-like body, as you can see, this is a star-like body. This is called asteroid body, and the phenomena that is around the organism, there is eosinophilia. This phenomena is called splendor hoplite phenomena. In the image you can see black necrosis around the eye or the face, then it is nothing but mucormycosis. I tell you my experience when I was non-academic JR in the emergency medicine. I saw a patient with necrosis in the face, and it was black color. Then only I diagnosed that this is a case of mucormycosis. I had never seen in my life. From that point only, I diagnosed it's a case of mucormycosis. I called my senior that here's a case of mucormycosis. He told that, bro, it's not that much common. You are mistaken. Then he came and saw, yeah, this is a case of mucormycosis. And there was no immunodeficiency at first. But later, when we saw the reports, then he was having B cell leukemia. So that was causing the immunodeficiency. Any case of immunodeficiency, sugar, on steroids, and having a black ishkar in front of the face, then it is nothing but mucormycosis. In microscopy, the mucor or the rhizopus species will have asepted obtuse angle hyphae like this. And in case of aspergillus, you will see septa, as you can see. Divisions are there. These are also asked in the INICET and NEET PG exam. Another important image is the sheath microfilaria. These are asked in quizzes also. So an interesting mnemonic, loveful wedding nail. आजकल सब लोग प्यार तो कर लेते हैं, बट शादी के टाइम में नहीं, शादी नहीं करना. एंड तुम लोगों के लिए जो होना चाहिए, प्यार मोहब्बत धोखा है, पढ़ ले बेटा मौका है. अभी के लिए मोटिवेशन. So loveful, that is in lower lower, it will be full of nucleus in the tail tip, and wedding nail, so in which area there will be no nucleus. Brugia, it is not mentioned, so it is in between. It will have two nucleus in the tail tip. Coming to chemotherapeutic agent side effects compiled in a single image. This image is present in the first aid, so I have taken it from there only. See, here you can see V in the head and in the hand and feet. So in head, the विंक्रिस्टिन and विंब्लास्टिन causes SIADH, and हाथ और पैर में क्या होता है, peripheral neuritis. C is present in the face, smiling, and in the ear, so it will cause ototoxicity, nausea, vomiting, and here the C is also present in the kidney, so nephrotoxic. डॉक्सोरूबिसिन एंड डोनोरूबिसिन डी, डी से तो हम लोग याद रख ही सकते हैं कि डी से दिल होता है, सो इट इज कार्डियोटॉक्सिक. सिक्स, सिक्स is in the shape of pancreas, so 6 mercaptopurine and 6 thioguanine causes pancreatitis. Another C below we have, that is the cyclophosphamide. It causes hemorrhagic cystitis. For its treatment we give mesna. बी, बी से है हम लोगों का लंग्स, जो कि बाइलेटरल होता है, दो होता है, लाइक दैट ऑल्सो यू कैन रिमेंबर बाई. सो ब्यूमाइसिन, ब्यूसल्फेन, दे कॉज pulmonary fibrosis. Bleomycin also causes flagellate dermatitis, as you can see in this image. And cornea verticillata is caused by amiodarone indomethacin nitarsudil. Amiodarone induced blue man syndrome also, it was given in the INICET. So here's are all the vegetative poisons, compiled in a single page. And another thing that the coaching institutes don't teach, because till now it has not come in question, but maybe in some way or the other in future this can come in question of NEET PG, that is the identification of the snake. मतलब स्नेक से आइडेंटिफाई शायद ना करने बोले, बोल सकते कि व्हाट काइंड ऑफ टॉक्सिन दे हैव, hemotoxin, myotoxin, or neurotoxin. So these two, Russell's viper, the viper family has hemotoxin, that is it causes hemolysis. Saw-scaled viper deserts में रहता है in the Rajasthan, so it has a more rough look, as you can see. And these figures, these trapeziums are not fusing, as you can see. In case of Russell's viper, these are mostly fusing, and the color is also a bit different. The head of the saw-scaled viper is also thicker, and it is more of rough looking. Another important difference is the banded crate and the sea snake. Both have bands, but in sea snake you can see that it is flattened laterally. सो उसका अगर क्रॉस सेक्शन देखेंगे, दिस इज लाइक दिस, एंड बैंडेड क्रेट इज ट्रायंगुलर. Sea snake, it is very much logical, is that they need to swim long distance, so they are laterally flattened. They need to counter high pressure, so for that reason also they are laterally flattened. Last one image that I will show of pathology is the anthracosis. As the name suggests, you will see black pigment deposition. In case of silicosis, what you can see is that this is one egg like shape calcification of the lymph nodes. This is called eggshell calcification. Now they ask that which all other conditions you find eggshell calcification. So these are sarcoidosis. From sarcoidosis you have to remember that it causes increase in ACE enzyme levels. It also causes increased vitamin D3 and hypervitaminosis and hypercalcemia also. For the treatment of hypercalcemia in sarcoidosis, you give steroids. Post radiation syndrome, you need to know the radiation recall phenomena. In case of healed TB, also from TB, Cohen's focus, Rankis complex, miliary TB. Like this, if you see one single word also, you have to correlate it. If you correlate and learn, then only you can recall better, and also in the exam correlated questions are asked. The last image is of asbestosis, that has the asbestos body or the ferruginous body, like this elongated ferruginous, because it is of the color of iron, that is the reddish brown color. So this is up for today. If you found this video to be helpful, do hit the like button, and If you want next part, then do comment. I will make a next part and we'll discuss more extensively regarding the preclinical subjects. So all the best for your upcoming exam.